Oh, we always love talking about the biotech sector. And here with his top picks, Joseph Thome, Senior Research Analyst in Biotech at TD Cowen. Joseph, always great to hear from you guys on this sector. Start off with your first idea here, please. United Therapeutics, what are they all about?
Thank you very much for having me. United Therapeutics is a biotechnology company focused on the development of cardiopulmonary drugs. They currently have a base business that is generating nearly $3 billion in annual revenues. But perhaps most exciting is that one of their therapies, Tyvaso, recently generated very encouraging phase 3 data in the treatment of idiopathic pulmonary fibrosis, or IPF. The data showed that addition of Tyvaso reduced the decline of FVC with pretty good tolerability versus standard of care agents in a placebo control. Our physicians find the data very encouraging. They think that this could be a frontline agent in the treatment of IPF, and there's high unmet need. Current standard of care agents only decrease the progression of IPF symptoms, but there's a high AE burden. Despite this, the market leader, OFEV, generates $4 billion in annual worldwide revenues. So we see IPF as an important growth driver for United Therapeutics going forward.
Your next idea, I think it's pronounced Unicure. Among others, other ailments, it's working on hemophilia, and it's got one of the first gene therapies here.
Yeah, so Unicure is a biotechnology company focused on these one-and-done gene therapies for the treatment of rare diseases. They do have a currently approved agent with hemophilia B, but perhaps the next big wave for Unicure is going to be Huntington's disease. In September, they reported data from their AMT-130 program in Huntington's, generating that one-time treatment can result in a 75% slowing of disease progression at 3 years versus natural history comparator. Our physicians indicate that this is great news for patients. There's about 40,000 patients currently in the United States, at least with Huntington's disease, and there's no approved agents to treat them. So we're hoping that this drug will be filed at the beginning of 2026 and be available to patients beginning later next year.
You have a PhD in microbiology and immunology from Columbia. Can you just explain it? Here's a really stupid question. So the body has trillions of cells, each with their own little bit of DNA. So how can a therapy affect DNA throughout my body?
Yeah, so, it's a very targeted agent. And so these therapies use what's called an AAV typically to deliver the therapy only to a specific target cell type. And so, for example, in the case of Huntington's disease, you're only going to be targeting these cells in the deep brain, knocking down a specific target. And so you can almost use RNA as a guide to make sure that you're hitting the therapeutic where you want to, but you're avoiding a lot of the things that you don't want to touch, so you have a efficacy profile without the tolerability disadvantages.
Of course, immunology, a famously simple subject. We shouldn't. Yeah. Finally, we're tight for time. Sorry. Xenon Pharmaceuticals, what are they all about, please?
Yeah, so Xenon Pharmaceuticals is a Canadian biotech company focused on the development of ion channel modulators for neuroscience disorders. The company is focused largely on a drug called azetukalner, which is going to report phase 3 data in patients with focal onset seizures in early 2026. The phase 2 data were strong. Azetukalner hits a lot of the boxes that our physicians are looking for. It's once daily. There's no titration, and it plays well with other anti-seizure medicines. Despite a lot of agents available for seizure disorders, about 30% of patients currently have nothing available to them. And so this will be the initial target market for azetukalner. We think the phase 3 is going to work, and it should have an initial strong commercial experience.
Thank you very much. I really appreciate it. I hope you'll come back soon. It'd be great to have more. I'd love to hear more from you about really the progress that's being made in gene therapy right now. Joseph Thome, Senior Research Analyst in Biotech at TD Cowen. Thanks again, Joseph.